So the question, what, in my opinion, the origin of this problem with prescribing medicines? Well, in my opinion, there are a lot of doctors who don't have enough training. They haven't been trained enough with regards to pharmacology, or they've been trained by the pharmaceutical industry, which is no good because that's full of interests. And this is a big problem. They are prescribing medicines without knowing enough about them, or they're prescribing them because somebody else has recommended them so that they can fill their pockets, which is also no good. On the other hand, doctors often don't have enough time to examine the patient or even look into their medical histories properly, and they end up missing things out, things that are very, very important before being able to prescribe medicine. So you have doctors who are prescribing medication without knowing enough about it, or because of their interests, and also they just don't have enough time. On the other hand, you have patients who expect to be prescribed a medicine all the time, and sometimes they come out of the doctor's surgery saying, oh, what kind of a doctor is this? He wouldn't, or he or she wouldn't prescribe me any medicines. Well, perhaps it's a very, very good doctor who's got your best interest at heart, and you should not be expecting to be given prescribed medicine all the time, because sometimes it's not the right thing to do. There are illnesses, diseases, or things that just disappear. You just have to give it a bit of time. Of course, you're going to feel unwell whilst you've got something like this, but you have to expect that you will feel unwell, and you just have to put up with it without expecting the doctor to always prescribe you something that is probably going to give you a lot of other side effects, which won't be any good, and whatever you have would have disappeared anyway. But the problem is doctors sometimes feel very pressurized by the pharmaceutical industry or by patients, but also patients also feel pressurized by doctors, because doctors prescribe things that quite often are not correct, as I say, because of lack of knowledge or because of interests or lack of time. And doctors and patients trust their doctors and end up taking these medicines, and sometimes they just have terrible consequences. So people often ask, what are Nolotil side effects? Well, Nolotil, metamizole side effects can be death. It can cause death or amputations. I know it can cause other things as well, but it can actually cause death or amputations. Okay. When we talk, people always say, oh, but all medicines can cause some side effects. Yes, but when you say that, you expect to get stomachache, vomiting, diarrhea. We're not talking about that. We're talking about something that can cause, just for a painkiller, for a backache, toothache, headache, gallstones, pain on your knee, any pain that you can take this painkiller for. You don't realize it can actually put your life at risk. I mean, that's quite something. And yet they give it to you everywhere, as not as a last resort either, which is how they should give it to you, but as first line painkiller. In fact, it's the go-to painkiller in Spain, okay, and most sold medicine in Spain. So if you check the data sheet, which is what doctors get, there in point 4.4, it says that Nolotil can cause agranulocytosis, which is its most feared side effect. This means it can lower your immune system even down to 0 sometimes, and this can happen to anybody, anytime, okay, even if you've taken it before without a problem. This means this is not just the British that can get it, because sometimes it's been said that it's the British or old people, but the Spanish are immune to it. Nobody is immune to it. Anybody can get this, okay? Perhaps the British are most susceptible to getting agranulocytosis, but it doesn't mean the rest of us are immune to it. And I know that because I have a lot of Spanish cases as well. What else? Yes, sometimes people get a phone call from the doctor. You need to get to a hospital. You've got no white cells. And this is because they've had a routine blood test. And doctors have found in this blood test that the person had no white cells whatsoever, which means they were at risk of getting an infection and not being able to fight it. This infection, you could get it from just touching a table, a wall, from being bitten by a mosquito, from anything, and you would not be able to fight it. And this is all because you've been taking Nolotil perhaps for a toothache or a backache, and you were walking around not knowing you had no immune system. And guess what? During the pandemic, during COVID, the lockdown, Nolotil was, or metamizole was included in Spain in the list of essential medicines to be given during COVID. This means people were being given this medicine which destroyed their immune system, which is not exactly the greatest of ideas to be like that before getting COVID, is it? So people were at home being prescribed by the doctor over the phone, Nolotil, to be taken without any kind of blood tests or follow-up tests or anything. So, if you were taking this, no immune system, and you got COVID, then what? All these people you hear saying, what? But what's all this about Nolotil, all these cases? Nolotil's been around for years and years without a problem, and there are no cases. The fact that it's been around for years and years doesn't make it any safer, or doesn't mean it is safe. And the fact that you haven't heard of cases, it doesn't mean they don't exist. It just means people don't notify the cases. The doctors often don't notify them, and patients don't. I have a lot of cases I've been told about, but people won't give me enough information, so it means I'm unable to notify them even like that, because people just cannot be bothered. This brings down your immune system. It kills your white cells basically. Sometimes it leaves you with no white cells, exposed to getting any infection and not being able to fight it. And often you get situations where people have an operation, and before the operation they've been taking painkillers. Hopefully this gets spotted when you have a blood test before the operation, but sometimes there may be a few days between the blood test and the operation, and if you're taking this medication, it might bring your immune system down to 0 in some occasions, and you go into this operation with no immune system, exposed to an infection which you won't be able to fight. Also, very often you get given Nolotil or metamizole after an operation, and then of course you hear, oh, he got an infection after the operation and died, not realizing that this person was left at risk of getting an infection and unable to fight it because they were given Nolotil or metamizole after this operation. Hello, the other day I was asked by journalist Miguel Jara, what are Spanish health authorities doing about this problem with Nolotil, metamizole? Well, to be honest, I haven't got a clue. I just don't know. In 2018, because of my work, they issued some recommendations, some guidelines, which have not been followed, and we've continued to get cases. We've now got over 350 cases that I know of. I'm sure there are a lot more that have not been notified. And they know about these cases, but they are not doing anything about it. They don't even reply to me when I write to them. I even denounced them to the Ombudsman last year, and they just said we're carrying out an epidemiological study. And that was over a year ago, and we've not heard about this study ever since. So I haven't got a clue what they're doing. But what I don't understand, I find it impossible to understand, is the fact that just recently they withdrew a deodorant from the market because of risk of causing cysts under the arms, and they had 4 notifications, okay, and they withdrew this from the market. Nolotil, metamizole, can cause death, can put your life at risk. It's not just a risk of getting cysts. It can put your life at risk, or risk having amputations, a lot of other things. And I've notified hundreds of cases, not 4, but hundreds of cases, yet they won't withdraw from the market. So I really have not got a clue. I just cannot understand. On top of it, to top it all, every time they are prescribing more and more anxiolytics and antidepressants to people who don't even have anxiety or depression, but they're just being diagnosed with it, or just being given this just for the sake of it. So I just don't understand it. And I am sure, I mean, this is a worldwide problem, and I'm sure people in Spain, because we are at the forefront of this, I'm sure people in Spain are not more depressed than people in any other countries. The problem is, here we are prescribing a lot more medicines than in the other countries. Well, the other day I was asked what our plans were for taking legal action against the Spanish health authorities regarding Nolotil and all the Nolotil cases. Well, we put in a claim because of fundamental rights being violated, and we put in a claim against Spanish health authorities because of their lack of action as well regarding Nolotil cases and its serious side effects. And they had 20 days to reply, and they didn't, for a change. So we are now taking legal action. We're going further. We're taking the next step, basically. Basically, patients' rights are being violated. They are not carrying out tests or an anamnesis before prescribing this drug. Also, they're prescribing it, sometimes they're prescribing it for over 7 days, and they're not carrying out any tests or blood tests when they should do, because this goes against the recommendations by the IMS. When they specifically ask not to be given Nolotil or Metamizole, they still get given it. So they are violating patients' rights. Also, sometimes when it says in their medical history allergic to Nolotil or Metamizole, they still get given it or prescribed, which puts patients' lives at risk. When patients refuse this Nolotil treatment, when they're in hospital, for example, and they find out they're about to be given it or they're being given it and they refuse it, often doctors refuse to give them any other medication, leaving the patient in pain. So basically, the patient feels pressurized to take this medication, and when they refuse to take it, they get penalized for it. And the IMS knows about all this, yet they choose to do nothing about this. And so we are now going to we're prepared to take it to the tribunals, court, whatever it takes. And we are also preparing a class action against Boehringer Ingelheim, the manufacturers of Nolotil. So we'll keep you posted. The big problem we have with the prescription of anxiolytics and antidepressants is well known. I've spoken to you about it other times. I've been having a lot of people talking to me at the association about these terrible side effects they get not only when they're taking the medication, but quite often after they've given it up. And this they talk about this emotional bluntness. Basically, they feel absolutely numb to both negative or positive emotions. They just have this emotional numbness, and sometimes they get this even after they've stopped taking the medicine, sometimes even if they've only taken a couple of tablets or something. So basically, these people, sometimes they feel that their lives will never be the same again, because it seems to just go on and go on. But in other cases I've been hearing about, people who have been taking this drug called finasteride. This is a medicine that used to be given, or is given to people, to men, for enlarged prostate. But because as a side effect they saw that it encouraged hair growth, and they started prescribing it also for men for loss of hair. And so a lot of men have it, and apparently it can cause symptoms that are very similar to those caused by the anxiolytics and antidepressants. They talk about the post-finasteride syndrome, and this characterizes for having depression, anxiety, cognitive complaints, decreased arousal, low libido, erectile dysfunction, and difficulty in achieving orgasm. Some of these side effects happen even if they didn't happen whilst you were taking the medication, but after you've given it up, after withdrawal, sometimes even months or years after withdrawal. So as I always say, medicines can be good for some people, but sometimes they can cause terrible side effects, and I'm getting these cases at the association ADAF, so I feel you should all know about it. Well, what other cases have I been receiving at the association of people affected by prescription medicines? Well, apart from the cases of people affected by Nolotil or metamizole in Spain, which I've got hundreds of them, people who have died, people who have suffered amputations because of it, like they've had their feet amputated, their hands, fingers. Also those who have not died, but they've ended up in hospital in intensive care, really seriously ill, and they've been there for days or weeks, and ended up with post-traumatic stress, insomnia, depression as a result of it, and their life has changed forever. Apart from all these cases, I've also received a lot of phone calls or a lot of messages to do with people who have been taking, they are taking or have been taking anxiolytics, antidepressants or tranquilizers. Some of the most typical anxiolytics people have been taking or are taking at the moment are the Benzodiazepines, like for example Lorazepam, Diazepam, Alprazolam, and also antidepressants. There are lots of them. Some of the most typical ones are Sertraline, Paroxetine, Citalopram or Citalopram. And a huge part of the population in Spain are taking these medicines, anxiolytics and antidepressants, for one reason or other. I mean, some people just go to the doctors because they may have headaches, dizziness, or any other symptoms, whatever it might be. But they end up having tests which reveal that there's nothing wrong, and somehow doctors just prescribe them anxiolytics or antidepressants for whatever reason. I mean, I don't know what the reason is behind this, whether it's I don't know, so that the patient goes home quietly and or feels happy that they've been prescribed something, or perhaps it's because of lack of time for the doctors or interests. I don't know. The fact of the matter is they keep giving this medication, and I'm getting people calling me because they are getting all sorts of side effects, not just when they're taking these medicines, but once they've given up taking them. Some people may have only just taken a couple of tablets, that's all, but they still get these side effects for a long time after they've stopped taking them. There are people who have these terrible effects after weeks, months, or even years after giving up the medicine. And these are like emotional blunting. This is basically, they feel numb to any type of emotion, positive or negative emotions. They just feel numb. Let's not even talk about sexual dysfunction. So many people suffer from that, from this after taking this medicine. And this destroys lives, relationships. Some people, because they feel so bad, they just don't want to live anymore. So they feel like committing suicide, and a lot of them end up doing it. The worst thing is that Spain is at the forefront of this, of consumption of these medicines. And once you start taking these medicines, it just gets worse because you end up needing more and more every time and higher doses. And the thing is that without any medication, these panic attacks or anxiety quite often would just go away after a few minutes. If you could just think of natural remedies like just focusing on something else, like on your breathing or other things. There are other things that can help without the need of taking these medicines. It's just such a huge part of the population taking them, and they just don't realize how bad this is. I'm not trying to alarm anybody, to raise any alarm. All I'm doing is, I feel, because I get so many cases at the association, I feel I should let people know, so that you know that other things can be done about it, so you realize how bad this can be and how it can affect your life. Because sometimes the cure can be a lot worse than the disease. Also, I mean, years ago, people used to feel sad because of problems in their relationships, perhaps with friends, with work, with their studies, and it was fine. They just felt sad or felt down, and they put up with it, knowing that tomorrow would be another day. And they didn't actually label this sadness with depression or anxiety or anything like that. They just put up with it, and these things make us what we are. And I think people should just think that we should focus on the good things and not give so much importance to the bad ones, and not label them, and just learn to deal with them without going to these extremes. Hello, as the president of ADAF, the Association for People Affected by Prescription Drugs, the other day I got a call from a psychologist. She's a child psychologist at a secondary school in Valencia. And she called me because she was extremely worried about the number of children who are being diagnosed with ADHD, attention deficit disorder, and being prescribed amphetamines. Okay? So a lot of children, our youngsters, are being prescribed amphetamines for something they probably haven't got, because this psychologist was very worried that a lot of these children, she's absolutely sure they don't have ADHD, but yet they are being diagnosed with it and prescribed these drugs. So this, along with the amount of people who are being prescribed anxiolytics and antidepressants, it's a huge problem, because we have a lot of people who probably should not be prescribed either of those things, because they really don't need it. They could solve the problem some other ways, or maybe they don't even have these problems. A lot of people are being prescribed antidepressants and anxiolytics when they don't even have depression, and they're walking around like zombies. Something needs to be done about this. This is a huge problem. I consulted a doctor and he told me a lot of children are being overdiagnosed and overprescribed. They're being overtreated, and this is a huge problem in our civilization. Things are not going right, and this is getting worse, and we need to change things. And this is the reason why I created this association. And with your help, I'm hoping to turn things around. And then there's the statins, the cholesterol tablet. Everybody, just about everybody gets prescribed those nowadays. Before, they used to prescribe them to you if your total cholesterol level was 260 or over. Then that was lowered to 240, then 220, and at the moment is on 200, making it just about compulsory for anybody to have these tablets. The fact of the matter is these tablets can cause terrible side effects. One of them is they can affect the muscles we use for breathing, and a lot of other really, really serious side effects. But the problem is doctors are often wrongly advised by pharmaceutical companies, so some of them feel that they are doing the best for their patients. Others may just have interests, and others just don't realize how bad this can be and how unnecessary, because when we don't have any risk factors, we should not be taking these tablets. Of course, I understand some people need to have them, and it's very, very important. I'm not against medicines or doctors prescribing medicines, but they should just prescribe them when it's necessary and not when we don't have any risk factors. So very often people just feel, the patients just feel very pressured by doctors to take these tablets, and when it's incorrect. But also there's all this marketing out there. They're always advertising not just the tablets but all sorts of other things which are all part of the same thing. And so people end up thinking that unless they take this cholesterol tablet, they will be in danger. They feel they need to take it to be protected. So because otherwise they're bound to die any minute of a heart attack or a stroke. Well, the other day I was asked about our GoFundMe campaign and how can people help. Well, ADAP is a non-lucrative association, but we need funds to be able to function, to work. Our work is extremely important because we are here to protect people's health now and in the future. All the information you can find in our ADAP website and also our GoFundMe page. There, from our ADAF website, you can also access my YouTube channel, where you can see a lot of Nolotil stories in both Spanish and English. And also you can access my Christina Research Information Facebook page, where there's also a lot of information. Please donate as much as you can. Even if you can only donate a little bit, but if a lot of people donate a little, we'll get somewhere. If a few people donate a lot, we'll also get somewhere. But if very few people donate very little, we just won't get anywhere. And don't look the other way, because often people look the other way thinking others will donate, and in the end, nobody does it. Share it. There has to be people there who have the means to be able to help. Famous people, all sorts of people. There are people with money there that should be able to help our cause, and it's a very important cause. So please donate. This is for your health. Thank you.